Slide 1, Title Slide. This is the Department of Human Services Licensed Child Care Center video, Staffing Requirements. Slide 2, Workers' Compensation Insurance Requirement.
Workers' compensation insurance is required for all licensed child care centers. Applicants should have a policy in place prior to submitting the application, even if that policy will not start until the program is licensed. Documentation of a workers' compensation policy is required prior to being issued a license and must be always kept in effect during licensure. The Department of Labor and Industry provides a form that programs must use to document compliance.
Slide 3, Staffing.
Understanding the staffing needs for a child care program is dependent on specific situations. Knowing how many staff will be needed in order to open and operate will depend on the size of the program and how quickly program enrollment grows. Regulations related to staff-child ratios, group sizes, staff distribution, staff qualifications, and age categories must be understood in order to keep children safe and maintain licensing compliance.
Slide 4, Staff Qualification.
A child care program will need to recruit and retain early childhood professionals that will qualify as a director, teachers, assistant teachers, and aides pursuant to Minnesota Rules 9503.0032 through 9503.0034 depending on the number of children being served. There are qualification requirements for each of the roles. In order to understand how a staff person will qualify as either a director, teacher, assistant teacher, or an aide, reference Minnesota Rules, Parts 9503.0031 through 9503.0034. A person qualifies for the position based on their own education and previous work experience. Child care centers are not required to have a director. If a child care center does have a director, the director must be at least 18 years old, be a graduate of high school or hold an equivalent diploma, have at least 1,040 hours of experience in staff supervision, and 9 quarter credits or 90 hours of accredited coursework in staff supervision, human relations, and child development. There are many different combinations of education and experience for an individual to qualify as a teacher or assistant teacher. Teachers and assistant teachers must be at least 18 years old. An aide is a staff person who carries out the child care program under the supervision of a teacher or assistant teacher. An aide does not need to document education or experience.
Slide 5, Staff-to-Child Ratios.
Specific staff-to-child ratios are required in licensed child care centers in Minnesota. These ratio requirements ensure children receive adequate care and supervision to promote their safety and well-being. Ratio requirements also set the stage for high-quality interactions between caregivers and children. The required staff-to-child ratios for infants, aged 6 months to 16 months, is 1:4. The required staff-to-child ratio for toddlers, aged 16 months to 33 months, is 1:7. The required staff-to-child ratio for preschoolers, aged 33 months until kindergarten, is 1:10. The required staff-to-child ratio for school-aged children, aged kindergarten to 12 years, is 1:15. When combining age categories, centers must follow the ratio requirements for the youngest child present in the classroom. For example, when a center has children combined in a classroom that are toddler-aged and preschool-aged, the required staff-to-child ratio would be 1:7. The the required ratio for toddlers.
Slide 6, Staff Distribution.
Licensed child care center must follow requirements for staff distribution for each age group a program is licensed to serve. The first staff person for an age group needed to meet the required staff-to-child ratio must be qualified as a teacher. The second staff person must have at least the qualifications of an aide. The third staff person must have at least the qualifications of an assistant teacher. The fourth staff member must have at least the qualifications of an aide. This pattern must be repeated until the number of staff persons needed to meet the staff-to-child ratio for each age category has been achieved. As an example, there is a program with 2 separate toddler classrooms, each licensed for 14 toddlers. Both classrooms are combined into one of the toddler classrooms at times when they do not have more than 14 children. To meet distribution requirements, the first staff person for this combined group of toddlers must be teacher qualified. If there are more than 14 children in attendance for any given day, the center needs to have additional staff in place before attendance exceeds ratio requirements. The second staff person on duty must be at least qualified as an aide, with the third staff person being at least qualified as an assistant teacher, and the fourth staff person being at least qualified as an aide. In this example, once the number of children in the first toddler classroom exceeds 14, the children must be split into 2 separate classrooms. To meet distribution, one classroom must be staffed with a teacher and at least an aide, and in the other classroom, the first staff person must be at least an assistant teacher. Keep in mind, when meeting distribution requirements, there are additional flexibilities the center can use, such as substituting an assistant teacher or aide for a teacher during morning arrival or afternoon departure, use unqualified subs, and/or use of experienced aides. The requirements for programs to use the allowed flexibilities for staff are specified in statute. It is important to document any flexibilities you use as required in statute and on your staffing pattern.
Slide 7, Staffing Patterns.
Written staffing patterns must be included in the program's administrative records. Staffing patterns must be completed for each classroom. The staffing patterns need to show which staff person, including the staff person's qualifications, will be working in the classroom during a period of time. The staffing patterns also need to show the number of children present. The staffing patterns are used to plan for compliance with staff distribution and staff-to-child ratio requirements. Scheduled breaks for staff, including nap time breaks, need to be accounted for on the staffing pattern. Additionally, if a staff person requires supervision, the staffing patterns must reflect that they are never working alone with children.
Slide 8, Personnel Record Requirements.
Child care centers are required to maintain a personnel record for each staff person. Requirements include, but are not limited to, staff identification information, documentation that the staff persons qualify for the position, the dates of first direct contact and first unsupervised contact with children, a cleared background study and training documentation. The Child Care Center licensing webpage has a checklist for personnel records that lists what is required to be maintained in a personnel record for a staff person. This form can be found under the Forms section of the web page under the toggle of Resource Documents licensed child care centers can use. It is a helpful form to assist with organizing personnel records and ensuring that all the record requirements and staff training requirements are met.
Slide 9, Background Studies. Who needs a study?
Minnesota statutes, Chapter 245C Human Services Background Studies requires certain individuals to have a completed background study in licensed child care programs. A worksheet has been created by the Department of Human Services titled Child Care Centers Background Study Worksheet. Is a background study required, DHS 7733A, to assist licensed programs and applicants in understanding which individuals will need a cleared background study.
Slide 10, Background Study Requirements.
Minnesota Statutes. Chapter 245C Human Services Background Studies requires background studies for individuals that will have access to children and/or their belongings in licensed child care settings. The background study determines whether a person has any disqualifying characteristic, which could prevent the person from working in a licensed child care program. A license cannot be granted until all required individuals have a cleared background study. For already licensed programs, any changes to controlling individuals will require cleared background studies prior to approval of the change.
Slide 11, Background Study Web Page and Contact Information.
The Background Studies Division is a separate division from the Licensing Division. However, there is a relationship between the two divisions, in that the Background Studies Division conducts studies on individuals that are required to have a cleared background study, and the Licensing Division ensures and enforces compliance with background study requirements. Access to more information about the Background Studies Division, as well as helpful resources on the background study process, can be found by visiting various pages within the DHS Background Study website, or by calling 651-431-6620 or emailing the department. For technical assistance with NET Study 2.0, applicants and providers should email dhs.netstudy2@state.mn.us. All other child care background study related questions should be directed to dhs.background@state.mn.us.
Slide 12, Training Requirements.
Training requirements for directors, staff persons, substitutes, and unsupervised volunteers in a licensed child care center are critical in promoting health, safety, supervision, and quality. There are two types of training requirements: orientation training requirements and ongoing training requirements, which are also referred to as in-service training requirements. If you need guidance on who must receive specific trainings, consult the definitions of directors, staff persons, substitutes, and unsupervised volunteers found in Minnesota Statutes, Section 245A.40, Subdivision 1A. Directors, staff persons, substitutes, and unsupervised volunteers must complete orientation training before they start their assigned roles. Orientation training cannot be used to meet the yearly hours required for ongoing, in-service training. Training requirements can be found in Minnesota Statutes, Section 245A.40. Additionally, the Licensed Child Care Center webpage contains information on training requirements and resources to aid in tracking orientation and in-service.
Slide 13, Volunteer and Substitute Use.
Licensed child care centers in Minnesota can use volunteers and substitutes in the program to assist with caring for and supervising children. A substitute is an adult who is temporarily filling a position as a director, teacher, assistant teacher, or aide in a licensed child care center for less than 240 hours total in a calendar year due to the absence of a regularly employed staff person. If a substitute works more than 240 hours in a calendar year in the child care center, a substitute will be required to complete all of the training required of a staff person. A licensed center must establish a process to track substitute hours to ensure those who work more than 240 hours in a calendar year complete the required trainings. All substitutes must complete the required trainings as written in Minnesota statutes, Section 245A.40, and must receive orientation in pediatric first aid and CPR within 90 days after first date of contact with a child. A licensed child center must be able to identify volunteers who are always supervised and those who are unsupervised at any time. Parents or other volunteers who are always under the continuous direct supervision of a staff person and never alone with children are considered supervised volunteers and do not require training. An unsupervised volunteer is an individual who assists in the care of a child, is not under the continuous direct supervision of a staff person, and is not employed by the child care center. An unsupervised volunteer is required to complete all the training required of a staff person. An example of an unsupervised volunteer is a parent who accompanies a child to the bathroom and is not directly supervised by another staff person. To understand if volunteers or substitutes will require a cleared background study before direct contact is allowed in the program, refer to the Child Care Center's Background Study Worksheet created by DHS.
Slide 14, Unqualified Substitutes and Experienced Aides.
In unexpected, temporary, or time-limited situations, a child care center may use current staff in the capacity of an unqualified substitute or experienced aide in order to meet distribution requirements. Since there are specific criteria and requirements that need to be met when using unqualified subs or experienced aides, centers will need to plan ahead in order to utilize them when needed. An unqualified substitute is a substitute who does not meet the qualifications for an assistant teacher or teacher position, but to meet distribution requirements, is used as an assistant teacher or teacher. Specific conditions must be met in order for a center to utilize unqualified substitutes. There are also limits associated with the use of unqualified substitutes. Finally, the individual must also meet specific requirements in order to be utilized as an unqualified substitute. An example of unqualified subuse could be a teacher unexpectedly calls in sick, and there is not another teacher qualified staff person available to fill in for that teacher. An aide could work as an unqualified sub for that teacher on that day, if all the criteria is met. An experienced aide is a staff person that is qualified as an aide and has a specified amount of experience working in childcare, and who the center designates as such. Experienced aides can work without being directly supervised by an assistant teacher or teacher when being used as experienced aides. Specific conditions must be met in order for a center to utilize experienced aides. There are also limits associated with the use of experienced aides. Finally, the individual must also meet specific requirements in order to be utilized as an experienced aide. An example of experienced aide use could be a situation where a teacher works in a preschool classroom with 10 children. There is not a teacher qualified staff person available to give the teacher a break. The experienced aide works in the classroom for an hour each day, giving the teacher a break. An aide could work as an experienced aide for that hour each day, as long as all the criteria is met. If assistance is needed with understanding how to calculate the number of hours that a center may use either unqualified substitutes or experienced aides, a child care center's licensor can help.
Slide 15, Variances for Staff Qualifications.
DHS may grant variances to rules that do not affect the health or safety of persons in a licensed program to help qualify staff persons as an assistant teacher, or director. These variances are titled Track 1 and Track 2 variances. Track 1 variances are for staff who are working toward qualification options for director, teacher, or assistant teacher, such as completing the minimum number of applicable college credits, a Child Development Associate credential, a bachelor's degree, etc., and/or gaining additional hours of experience. Track 2 variances are for staff persons who have experience working in a licensed child care center, have completed a minimum number of training hours from a list of approved training organizations, and who have committed to completing additional training each calendar year. Variances must be requested and are not in effect until the licensor has approved the variance.
Slide 16, Professional Development and Retention Supports.
There are several resources available to licensed child care providers in Minnesota to support the professional development of child care staff and provide staff retention support. Child Care Aware of Minnesota offers several opportunities for child care providers and their staff. Offerings include professional development advisors that assist programs in accessing face-to-face learning opportunities. Eager to learn online courses that are designed to provide quality, accessible, educational opportunities for people who care for children, Empower to Educate bonuses and job placement supports, REETAIN bonuses, and TEACH awards. CDA awards help providers pay for the required training, application, and renewal of the nationally recognized Child Development Associate credential. The Minnesota Center for Professional Development offers both Achieve, which supports child care program staff by documenting and confirming educational accomplishments and creating a career lattice, and the Develop tool. Develop processes membership application submissions and provides personalized membership application support based on the needs and goals of an individual working in a child care program. Develop also assists programs and individuals find approved trainings that count toward advancement on the career lattice and a learning record to document attendance in Develop approved trainings.
Slide 17. Thank you.
The content in this e-learning is current as of the date presented. The licensing division reserves the right to update or revise as applicable. Thank you for watching.